Do you know that certain common medications might be silently damaging your kidneys? We live in a time where medications are ubiquitous, offering relief and treatment for countless conditions. However, some of these medications can be nephrotoxic, meaning they can cause direct or indirect harm to the kidneys. As we age, our kidneys naturally lose some of their efficiency, and the introduction of nephrotoxic medications can exacerbate this decline, leading to severe health issues. Kidney damage can range from mild dysfunction to complete failure. The risk of kidney damage from drugs, known as drug-induced nephrotoxicity, increases with age and pre-existing kidney conditions. There are two primary types of kidney damage from medications: dose-dependent toxicity, where the damage increases with higher doses, and idiosyncratic toxicity, which is unpredictable and varies significantly between individuals. Understanding these risks is crucial for making informed decisions about your healthcare. In this video, we will explore the impact of common medications on kidney health and provide practical tips for managing these drugs safely. Understanding the risks associated with these medications can empower you to make informed decisions about your healthcare. Let's delve into the 7 common medications that can be harmful to your kidneys. 1. Antibiotics. Antibiotics are frequently prescribed to combat bacterial infections. While they are effective in treating conditions like strep throat, pneumonia, urinary tract infections, UTIs, and skin infections, they can also pose significant risks to your kidneys. Common antibiotics include Cipro, Augmentin, Flagyl, Bactrim, and amoxicillin. Antibiotics work by killing bacteria or preventing their reproduction, but they cannot treat viral infections such as colds, flu, bronchitis, and most sore throats. Overprescription and misuse of antibiotics can lead to side effects such as diarrhea and liver and kidney problems. Even when used correctly, some antibiotics, such as polymyxins, aminoglycosides, and vancomycin, can harm your kidneys. Your kidneys play a crucial role in removing antibiotics and other drugs from your body. However, antibiotics like polymyxins can damage kidney cell membranes, potentially causing kidney injury. Aminoglycosides can accumulate in kidney cells, causing cell death and harming kidney tubules. The exact mechanism by which each antibiotic causes kidney injury is still not fully understood, but it likely involves inflammation and harm to kidney cells. To use antibiotics safely and protect your kidney health, it's important to use them correctly. According to a report from the Centers for Disease Control and Prevention, CDC, and a study published in the Journal of the American Medical Association, nearly 1/3 of antibiotics prescribed in the United States are not appropriate for the conditions being treated. Before taking antibiotics, ask your doctor if they are necessary and follow the dosage exactly as instructed. Never save antibiotics for future use or give your prescribed antibiotics to someone else, as prescriptions are tailored to individual health needs and conditions. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are widely used to ease headaches, sprains and strains, colds and flu, and pain from arthritis. Common NSAIDs include ibuprofen, aspirin, Motrin, celecoxib, and naproxen. Over 30 million people take NSAIDs daily, making them one of the most common medications. NSAIDs work by blocking an enzyme called cyclooxygenase, COX, which helps produce pain-causing substances. However, COX is also important for protecting the kidneys during stress and helping regulate sodium and water excretion. By blocking COX, NSAIDs can reduce blood flow to the kidneys, leading to fluid retention, high blood pressure, and even mild temporary kidney impairment. Prolonged use of NSAIDs can cause acute tubular necrosis, where kidney tubules die due to lack of oxygen, and acute kidney failure. A study published in the Journal of the American Society of Nephrology found that NSAID use raised the risk of acute kidney injury by 26%, especially within the first 30 days of use. Another study showed that most patients' kidney function decreased after NSAID use, but returned to normal after switching to another pain reliever drug. Kidney issues stemming from NSAIDs are a significant concern, affecting 1% to 5% of daily users worldwide. To reduce the risk of kidney damage from NSAIDs, limit their use and always follow the recommended dosage. Consult your doctor if you have any concerns or if you need to use NSAIDs regularly. 3. Diuretics. Diuretics are commonly used to treat conditions like fluid retention or swelling, often seen in heart and kidney failure and liver cirrhosis. Some diuretics are available over the counter, while prescription diuretics are typically stronger. Common diuretics include hydrochlorothiazide, HCTZ, bumetanide, Bumex, furosemide, Lasix, spironolactone, aldosterone, and acetazolamide, Diamox. Diuretics work by increasing urine output and expelling excess salt and water through urine. They are generally beneficial for managing hypertension, a leading risk factor for kidney disease. However, excessive use or high doses of diuretics can lead to dehydration, a risk factor for kidney damage. A study conducted from 1999 to 2010 at a hospital found that patients using diuretics had higher rates of kidney disease and its risk factors like hypertension and diabetes. About 27.5% of the cases of acute kidney injury were caused by diuretics alone, while others were due to a combination of diuretics and other drugs. Patients with chronic kidney disease, CKD, should stay hydrated and regularly check for electrolytes and kidney function while taking diuretics. 4. Proton pump inhibitors, PPIs. PPIs are widely used medications available over the counter to treat conditions like gastroesophageal reflux disease, GERD, and acid reflux by reducing stomach acid production. Common PPIs include omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid. PPIs are effective in soothing acid-related discomfort but carry risks, particularly for kidney health. They have been linked with acute interstitial nephritis, AIN, a kidney disorder characterized by inflammation in the spaces between the kidney tubules. Long-term PPI use can lead to lower kidney function and acute kidney injury, which can progress to chronic kidney disease, CKD. A cohort study published in the Journal of Pharmacotherapy found that PPI users had a 4.35 times higher risk of acute kidney injury compared to non-users. PPI users also had a 1.2 times higher risk of CKD compared to non-users. People taking PPIs should have regular checkups to monitor their kidney function and magnesium levels. 5. Angiotensin-Converting Enzyme, AC. Inhibitors. ACE. Inhibitors are prescription medications widely prescribed to lower blood pressure and manage conditions affecting the heart, blood vessels, and kidneys. Common ACE inhibitors include lisinopril, Zestril, captopril, Capoten, enalapril, Vasotec, and benazepril, Lotensin. ACE inhibitors work by blocking an enzyme that produces angiotensin-2, which narrows blood vessels and increases blood pressure. By stopping this enzyme, ACE inhibitors help relax blood vessels, lowering blood pressure and reducing stress on the heart. They improve blood flow to the kidneys, easing the workload on these vital organs and reducing the presence of protein in the urine. However, ACE inhibitors can cause acute kidney injury when combined with NSAIDs and diuretics, or when taken by dehydrated individuals. While they are generally protective for the kidneys, they should be used with caution, particularly in patients with heart failure, CKD, or bilateral renal artery stenosis. Patients should stay hydrated and regularly check their kidney function while taking ACE inhibitors. 6. Antiviral drugs. Antiviral drugs are used to treat serious or long-lasting viral infections like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. Common antiviral drugs include oseltamivir, Tamiflu, zanamivir, Relenza, and remdesivir. Antiviral drugs can clear viral infections but pose risks to the kidneys, either through direct toxicity or crystal buildup that can cause kidney stones. For example, remdesivir, used for COVID-19 treatment, contains a substance called SBCD, which can build up and cause kidney toxicity in people with kidney issues. Other antiviral drugs like cidofovir, adafovir, fosamprenavir, acyclovir, interferon, and tenofovir can cause acute tubular necrosis, while atazanavir can cause inflammation in the interstitial tissue of the kidneys. Patients taking antiviral drugs should do so under close medical supervision to safeguard their kidneys. Regular checkups and monitoring kidney function are crucial for preventing drug-induced kidney damage. 7. Lithium. Lithium is a prescription medication used for mood stabilization and treating mental illnesses like mania and bipolar disorder. Common brand names include Priadel, Camcolit, Lisconam, and Lie Liquid. While lithium is effective in managing mood disorders, long-term use can lead to serious kidney issues, including acute and chronic kidney disease and kidney cysts. The primary concern is nephrogenic diabetes insipidus, where the kidneys cannot respond properly to antidiuretic hormone, ADH, resulting in excessive thirst and frequent urination. In rare cases, long-term lithium use can lead to end-stage renal disease, ESRD. Patients taking lithium should maintain a regular diet with enough salt and fluids, get yearly blood tests to check creatinine levels, and seek medical help if any symptoms of kidney trouble arise. Monitoring kidney function and adjusting dosages as needed can help manage the risks associated with lithium use. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "Great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. Medications are essential for treating various medical conditions, yet certain drugs pose significant risks to kidney health. Antibiotics, NSAIDs, Diuretics, PPIs, ACE inhibitors, antiviral drugs, and lithium all have the potential to impair kidney function. It's crucial to avoid or carefully manage the use of these medications, especially in individuals with existing kidney disease or those predisposed to kidney disease. Working closely with healthcare providers to select treatments that minimize risk to the kidneys, adjusting dosages as necessary, and monitoring kidney function regularly are key steps in protecting kidney health. A healthy lifestyle, including a balanced diet, regular exercise, and proper hydration, can also help minimize the need for medications and protect your kidneys. If you have any concerns about your kidney health or are experiencing symptoms related to kidney issues, consult your doctor for proper evaluation and guidance.